And Happy New Year, everyone. Welcome to Healthier Ever After with Grace and Michelle. Here at Healthier Ever After, we're going to talk about health and wellness and that journey with different topics that we think are really important while we're working to live our healthiest and our best lives. We're going to bring on special guests each time, experts who can answer your questions in real time. So please don't be shy. Ask questions, share your thoughts and ideas with us in the comments. I'm Grace, the Solution Strategy Director for Chronic Conditions with Teladoc Health. I'm a registered nurse by background and a certified diabetes care and education specialist, really passionate about chronic conditions and passionate about diabetes prevention, diabetes management, access to diabetes education, and support for diverse and underserved, underrepresented populations.
Awesome. Thanks, Grace. And I'm Michelle. I'm one of the expert coaches here with Teladoc Health, and I specialize in health and wellness coaching. I work within our diabetes, hypertension, weight management programs, and I'm so excited to connect on today's topic. It's really important to me as well, and we'll dive into what our topic today looks like.
Awesome. Thanks, Michelle. Today, we have a special guest with us, Dr. Glenn Davis. Dr. Davis serves as Vice President of Clinical Programs at Teladoc Health. He provides guidance for ongoing development of our Teladoc solutions and oversees the clinical outcomes for Teladoc's chronic condition management, as well as our virtual primary care solutions. Dr. Davis has been instrumental in establishing and maintaining strong relationships with Teladoc's clients, partners, and stakeholders. And he does a phenomenal job of really demonstrating the value and the impact that Teladoc solutions bring, the health outcomes, the member satisfaction, the cost savings. Dr. Davis earned his medical degree from the University of Michigan. He's especially proud of that right now, and holds an MBA from the Mendoza College of Business at the University of Notre Dame. He's board certified pediatrician with over 20 years of experience in the healthcare industry. So welcome, Dr. Davis.
Thank you. Thank you so much, and Happy New Year. And of course, it's always good to come out on top. Every now and then it's good to be a winner. So.
Especially a good year for U of M, huh?
Absolutely. We'll take it.
Yes. Oh my gosh. Well, thank you so much for being with us, Dr. Davis, and Happy New Year to you as well. We're excited to connect because we want to speak to you today about this new year, right? It's a brand new year. And what does that look like for everybody? It looks different. But our first question for you that we're curious about is we're going to be talking about starting off the new year with a healthy mindset. So many create new goals that they want to achieve for the year. Some common ones that come up, and I'm sure you see it in your practice from time to time, are I want to eat healthier, I want to exercise more, I'm going to eat more vegetables. But aside from those typical ones, we're curious, what are some not so common goals people can set for themselves that we may not think about?
Yes, and quite often, this is certainly goal setting season. But quite often people will set goals that maybe are not quite attainable, right? And that's usually what I hear, what I see most frequently. People say, "Hey, I want to make sure I run a half marathon this spring," or I want to make sure I set out to run maybe lift weights and get to the point where I'm down to 5% body fat by July. And of course, some things just don't make sense, right? And so that's unfortunately the thing that I see most frequently, whether it's with regards to exercise or professionally. People sometimes set goals that are unrealistic, and therefore, most often you're setting yourself up for failure. I think that the best approach is typically to set goals that are attainable and take baby steps to reaching those bigger goals.
Right. So baby steps, bite-sized goals to get you to that desired outcome eventually. I love that.
Exactly.
Yeah, and you bring up a good point. So I kind of want to take a little step back here. So what we're talking about sounds to me like those SMART goals, right? Michelle, Dr. Davis, I'd love to hear your approach and how you talk to folks about setting those specific goals.
Sure. Yeah, Dr. Davis, I want to hear from you because first off, right, you tell someone a SMART goal, it's nothing to do with intelligence. So I'll start off with that, but let's hear what you have to say about them.
Yeah, the first thing you need to do is actually explain the goal. And I would say, unfortunately, when we think about healthier lifestyles, quite often, from a medical standpoint, physicians are often not great in helping people understand how to reach that goal. They just say, "Hey, you need to lose 15 pounds. See you in 3 months," right? And so that's not very effective. So, but really, if you sit down and talk to a patient and break down, okay, losing 15 pounds, what does that look like? Well, it looks like a better diet, healthier lifestyle from a dietary standpoint, some sort of physical activity. It doesn't mean necessarily that you are enrolling in some sort of, high intensity workout class on a regular basis, but it could be something very simple. Hey, I'm walking my dog 2 or 3 times per day, or I'm, getting involved in an activity, maybe a local volleyball team or something like that. But some sort of way to increase activity. And then beyond diet and lifestyle, sleep is always important as well. So can I get to a point where I'm getting to bed at a decent time? Because quite often those who are staying up later, they continue to eat until it's time to go to bed, what they consider to be bedtime. So really like to look at, okay, what's the big goal? Then break it down into smaller goals that we're looking at. And then from there, that's where we develop the SMART goals based upon that SMART approach.
Yeah, I love that. And something you said that resonated with me is being told to do something, right? And I'm not saying this for all doctors, but a doctor, like you mentioned, lose 15 pounds. That's an external motivator, right? And we find that the most change comes from internal motivation. So that's why SMART goals are so great. And what they stand for is specific, measurable, achievable, relatable, and time bound. And what that means is instead of just saying, for example, I will eat healthier, that's so vague, right? And that is one of those goals that can start to be a little confusing. And a month from now, what the heck did that mean 3 weeks prior? So taking all of those little steps can really be helpful to define your goal and make it all of those things I just mentioned. So instead of I will eat healthier, an example of a goal I had with a member earlier is starting next Monday, I'll add fruit to my lunch each day and I'll shop for fruit this Sunday so I'm ready. You literally know the day you're going to do it. You know the meal you're going to do it. So instead of saying, I'm going to eat fruit with every single meal, is that attainable? I mean, fruit's kind of expensive right now, so I don't know, but, really making it measurable. So I love that. And sleep too, right? Example, I'm going to sleep more. What would that be in a SMART goal?
And time bound. You're setting not just, specific day you're going to do something, but over the next week, over the next 2 weeks, over the next month. So once you've achieved that goal, okay, that's a win. Psychologically, that's a big win. Then you can move on to the next goal. I'm going to cut out, drinking pop or soda, depending on where you live in the country, call it either or. But how are we going to do that, right? And over the course of 2 weeks, 3 weeks, work on cutting back on those carbonated beverages. So absolutely love what you said there. And that's the type of approach I'd recommend for patients and members.
And if I could just add to, you got to make it realistic, and it's not a all or nothing. It's not eliminating everything. If you are a soda or pop drinker, and you drink a couple sodas a day, maybe, just cut back to one, right? You start somewhere. Those small changes lead to positive outcomes as well.
Exactly.
Absolutely.
Right. Another one too is I'm not going to eat past 6 p.m. Well, what if you go to bed one day a little bit later? I mean, that's if you go to bed at 10, but to your point, Dr. Davis, let's try to go to bed a little earlier for some people. I mean, who's to say that's so many hours without food? So it's really just like you said, Grace, making it realistic for you. I love that.
Absolutely. And certainly you have to make room for, I would just say cheat days, right? And it could be certainly around the holidays where a goal as far as eating sweets or not eating sweets and eating appropriately, you may put that to the side for Thanksgiving, Christmas, put it to the side a little bit and then get right back on it afterwards. Or certainly, as you mentioned, the goal of not eating it into the late evenings. If you have a work event and that event, doesn't start until 7 o'clock, okay, for that night, that goal is going by the wayside, but it's not going to be a habitual cheat type of thing. But every now and then things are going to deviate just a little bit. Absolutely.
Yeah, and I love you saying that. Actually, one of my members, we developed a goal and we emphasize, I literally capitalized day and birthday and holiday, right? We want you to enjoy those treats, and it's a holiday, not a holiday, right? So what do you do before the holiday, after the holiday to really try to stay on track, but honor the fact that it is that holiday and you enjoy it. So I love that. Yeah. So another question that came in is, what's your advice on having a doctor or a medical professional help you with your goal? And what's the best way to go about that?
I think that's a fantastic idea. And whether it be a physician or a nurse or, a health coach like yourself, certainly helps to have someone help you set those goals. And then really working on, how do I get to that point? How do I actually, okay, I want to lose 10, 15 pounds. I want to, if I'm living with diabetes, get my A1C from 9 to 7. What are the steps I need to take? And sit down with that physician, that nurse, that healthcare professional, and have them work with you to say, okay, this is what it looks like to reach this goal. I think that's really important. also brings about some accountability. You don't want to go back to that doctor or that nurse in 3 months and you haven't even, come close to achieving that goal. So having that accountability partner, I think, is really important. In this case, it could be that healthcare professional.
Yeah. I love that,
100%.
right? Because it can be a little vulnerable to bring it up to somebody besides yourself, but the accountability aspect is so huge in achieving some of these goals. So I love that.
Absolutely.
Yes. I know, Michelle, you would make an awesome accountability partner for sure. So I know I'm a person who really likes to see results quickly, and that's not necessarily realistic, right? But who doesn't? I know that this can take time as well. And so, sometimes we get overwhelmed, right? Like I do step on the scale every day. It works for me. And I know there's a lot of research and data that shows there's a lot of good reasons why you should do that. But how frequently should we be checking in on our goals and this data, these numbers?
I think it's great to keep track. Yeah, I want to say, well, on a daily basis is fine, but at least on a weekly basis to make sure that you're making progress, right? So if whatever your goal may be, whether it's exercise related, diet related, it could be if you're living with hypertension, actually taking your medication every day. Check in weekly and make sure, hey, how am I doing on this goal? Is this actually working? If not, it allows you a chance to sort of recalibrate, and maybe a recalibration of the goal altogether, or a recalibration of how we're going to reach that goal. So I think it's really important to check in and make sure you're, making progress on that goal over time.
Yeah,
definitely.
right. You're putting in the effort. So sometimes getting, data behind it can be really helpful. And it looks like, Dr. Davis, a question came in from a viewer. How about, and it kind of goes hand in hand with what we just talked about, how about daily journaling and weekly, monthly, quarterly reviews of what we write? So it's looking a little bit more into the physical, actually keeping that journal of your goals. So what are your thoughts on journaling and how it keeps you on track with certain goals?
Absolutely. If you're able to track, again, whatever parameter you're looking at, able to track how you're doing on a daily or weekly basis, sort of hold yourself accountable. You can see what you're doing. And I think that's one of the big powerful tools with food logging. It actually causes you to pay attention to what you're eating. Quite often people say, well, my diet is actually pretty good. But when you sit down and start logging it, you realize, I snack a little bit more than I thought I did, especially if you're working from home. It's so easy to walk out to the kitchen and grab, a snack, may not be so healthy. So if you're really keeping track of what you're doing, it does help you understand where you can improve. And then over time, again, helps keep yourself accountable as to how you're doing and how you're progressing.
Exactly. And guilty as charged with the snacks and not realizing sometimes how quickly they add up. But yes, and journaling too. I had a member, you don't have to buy them, use whatever modality you want, your phone, a piece of paper, but they actually make goal planning journals that you can buy that literally split it up into SMART so you can really make them measurable. Those things are out there. So
absolutely. And I think you can also take credit for things you haven't thought about. For example, when you think about tracking steps, it could be as simple as, again, hey, I walk with my wife, we walk the dog in the evening. Let's take credit for that. Sometimes it's that 10,000 step goal, you're doing more work than you actually think you are, but you have to allow yourself to take credit. So set that Apple Watch, that smartwatch, so that you can really track those steps, including things that you don't consider to be exercise, but they actually are a form of exercise.
There's that mindset, right? Like you have to show mercy and grace to yourself, right? Like you said, even if you're just parking a little further away from Target, right? Before you go in, a little far away from the store. If you're just dancing around in your living room, right? You don't have to necessarily go to the gym. Just movement, physical activity, and take that into account as well.
Yeah, think about the relevant portion of that, the SMART goals, making sure it's something. If you're talking about exercise, what do you enjoy doing? It's not that, hey, I read something in the newspaper and it says if I'm over 50, I have to lift weights because I need to have more muscle. But if you enjoy, jogging, or you love playing tennis, well, then let's do that. If you do that, 4 or 5 times per week, we're much further down the road than we are if we're focusing on weightlifting, which is something you may not enjoy. And then that becomes self-defeating. So really doing things that are relevant to you that you enjoy doing.
Yeah. And even so much too, it kind of combines, writing down the journaling aspect of keeping a goal and something you mentioned, Grace, that all or nothing mindset. So I've worked with a member once who all or nothing mindset was really something she was trying to navigate. And we had physical activity goals, and we made sure that they were relevant, time bound, and they just weren't working for her. So then we noticed that she was going to all or nothing. It was too lofty of a goal to say 30 minutes a day. So instead of that, she used her journal to have, instead of a to-do list, it was a to-done list. And whatever that meant for her, if she did something that she knows was towards a health goal of whatever facet, so today I walk the dog for 10 minutes, she put a check mark in her journal. Right. So it's just interesting things to reword what's going to work for you.
I love
I
that.
love that.
To done list.
Mm-hmm.
Very cool.
Yeah. Well, let's see here. Next question. There may be people listening today who haven't even started considering health goals or may not even plan to set one for the year. And with that, what are some ways to check in with ourselves at the very least to better understand our needs? So it's kind of pushing away from that New Year's resolution goal, which I don't think is necessarily a bad thing. So what do you have to say about that?
Yeah, absolutely. And quite often people feel like, well, so many times in the past I've failed. What's the point of trying again? I've tried so many times to lose weight. I've tried so many times to get my blood pressure numbers to drop. What's the point of trying again? But I think using this framework in the same way we use it at the office, applying it to your home, your healthy lifestyle can be very beneficial because it is not about those lofty goals. It really is about that daily building. And that's what's going to long-term longevity. You think about longevity in the long term lead to better results. I really would encourage everyone, even those who are in pretty good shape, to think about how can I get a little bit better this year? What can I do a little bit differently? It's only going to help us in the long run.
Yeah, I agree, Glenn. There's times where we can be our worst critic, right? And we set these lofty goals, maybe aren't too realistic. Maybe we're not following that SMART goal kind of objective. And so we have some missteps sometimes and we feel like, there's no recovering from here. Like, how do I pick myself up? And so how should our listeners think about their failures when it comes to being healthy?
I know it's said quite often, but I would say that it really is a learning opportunity. And it's a chance to look at doing things a little bit differently. If what you've tried before hasn't worked, how can you look at another route to get to that better state of health? Whatever condition you're living with, how can you use another route to get there? And the routes are going to be maybe a little bit different for everyone. I think of a time in the past where, one of my neighbors, he actually did this workout program. In the summertime, he comes out and rips his shirt off and he's by the pool and, and it's like, yeah, that's really not for me, right? And so I'm not doing that. But it's just that realization, hey, that's not something I'm going to be able to do or willing to do. But what can I do to actually get to a better state of health? May not be my 20-year-old self, but certainly to a better state of health. So I think having that type of mindset, even if you failed in the past, there's still other ways that you can move forward and really be successful moving forward the next time through.
Exactly, right? Like reframing, it's not a failure, it's an opportunity for change, right? And it's so powerful too, just to remember self-compassion, right? You didn't do that workout video and rip the shirt off by the pool. That's okay. That wasn't what your goal was. So just if something didn't work for you, and that's kind of where I mentioned earlier, kind of placing emphasis away from a New Year's resolution. If it didn't work for you in 3 weeks, who's to say you don't have a February resolution? It doesn't have to be just the beginning of the year. So.
Yeah, that's really good. Looks like we got another question here. So I'll let you both chime in on this, but how can I create a realistic timeline for achieving my health goals?
And I think it does make sense to think about it on a monthly or quarterly basis as to how you're going to reach those goals. So again, the notion that you're going to lose 30 pounds in 4 months, again, that's just something that's very difficult to achieve. But if you can look and say, okay, by April, I will have lost 8 pounds, 10 pounds, or whatever that number looks like, something that's achievable, then you can move on and think about other goals throughout the year that are also going to lead to weight loss. And so now I'm going to look at my diet. Every day I'm going to try and get my dinner plate full, or half of it will be fruits and vegetables, and work on that for the month. Okay, and then so you're moving towards that better state of health, and therefore losing weight throughout the year instead of putting forward that really lofty goal. And I hate to see people do that and set themselves out for failure. And again, the next year, they really don't want to set any goals. So if we can do those baby steps, those smaller goals, that leads to the long-term, really magnificent improvement over time.
Yeah, right. And leaning on people like your doctors or someone, even your health coaches, of what does a realistic goal for weight change look like? What does a realistic goal for physical activity look like? So I think that was a great question, because at the end of the day, I want to lose 30 pounds by this date. Why do you want to do that? Why want to fit into this dress for a wedding? Okay, how do we get you to that point week by month by quarter, like Dr. Davis said? So I think that's great.
Yeah, I think about my own personal life. My wife and I, we joined the pickleball, or the fraternity of pickleballers here in the US. We realized that, we were both trying to become more active, but we sort of like to do different things. And how can we have a common activity that we do 1 or 2 nights per week when it's warm here in Chicago? And pickleball really, fits that bill. It's not an overly intense type of activity, but it's social. So you have friends that you can play with. My wife can, play with some of her girlfriends. I can play with them as well. And it's just something that the two of us can do together. So in that way, it really is something that is more social, and therefore we're definitely going to do that on a weekly basis.
Love that. Within our app, there's also action plan. There's lots of great activities that you can choose from with ways to exercise or increase your physical activity. That, again, if you don't have access to a gym or you don't feel comfortable walking around your neighborhood, there's several different ways to increase your physical activity to meet those movement exercise goals within your own home. And the coaches are excellent at helping come up with ways as well.
Yeah, and I love you saying that, right? We do have a ton of different exercise routines on there if we're going to look at exercise. But to your point of making the goal realistic, to tell someone who has lower joint pains to go walk outside, maybe that's not feasible for them. So working with somebody to see something that's attainable, even chair exercises, that counts.
Right.
Yeah. So.
Absolutely.
Oh, this is a fun question. All right, Dr. Davis, everyone loves to know how things work behind the doctor scenes. So we want to know, can you share with us how you plan on making your health a priority this year? And are there any things that you're actively working on right now?
Absolutely. So for me, again, it's looking back at things that have not worked so well. And as I get older, my joints don't hold up quite as well. So the idea of going out and running as frequently as I have in the past, those types of activities I enjoy, need to be altered a little bit. So, again, mixing things up. What else can I do? Can I do a little bit of weight training? Can I do some other types of activity? And then diet. I mean, diet is huge. And so how can I make changes that are something that makes sense with my culture? So living in the upper Midwest, plenty of cheese, right? So how can I control cheese intake and things of that sort to a healthy level? But also thinking I have food allergies. I have a tree nut allergy. So a lot of the diets that really, let's say the plant-based diets, quite often they're high in nut content. So I can't go that route. So which route can I go? Maybe I can go to cutting out red meat and really focusing more on vegetables and fruits to meet my weight loss goals and other goals that I have based on my health history. That's really what I'm looking at here in 2024. And I think that sort of brings up another point. For certain cultures, it doesn't make sense for someone who comes from a certain culture to try and do an extreme diet that is not going to be something that's attainable within that household, within that culture. So for me, it's a food allergy that holds me back, but certainly other cultures, around the world, it's very difficult to talk about going to an extremely low carb diet, or it's very difficult to talk about going to an exclusively plant-based diet. So it needs to be something that, again, relevant to that patient. And in my case, it happens to be something that will allow me to avoid nuts, which is ultimately going to keep me much, much healthier, right? So that's sort of my outlook for 2024.
That's awesome. We have another question. So the question is, what modalities do you use for longitudinal patient engagement?
Again, I think that the technologies that we have right now are really fantastic. Didn't have them 34 years ago. So the idea of being able to have someone log foods and really understand their caloric intake, their macro intake, if they're focused on that as well, super important. And then again, those smartwatches, those Fitbits, to be able to take a look at activity and really closely monitor activity. Those are two big advances. I think that we sometimes forget and don't lean on those as heavily as we should, but those are two that I think are really important.
Yeah, I mean, just speaking about device change, all the different things, even for certain members, right? Just the technology that's out there for tracking, and a little bit behind the scenes too. The way that a lot of different healthcare places work now, it's much easier to even see a patient, or in this case, members, go along their health journey. I mean, that's one of the reasons I became a coach, is I have that opportunity to work with members and see them go through years of change, which
Absolutely.
is pretty neat. But I am curious, Grace, I'm putting you on the spot. Do you have any
Uh-oh.
resolutions or goals for this year? Dr. Davis, we heard his. Do you have any?
Yeah, for sure. So, just to move more, I definitely have that. I struggle with that all or nothing mentality, and it's something I've been working on. But just trying to move every day, some way, somehow. I love to dance. I don't go to the club or anything like that, right? I have the club in my living room. My girls try to get me to go out with them, but we're not doing that. I also have a Peloton, so just trying to like do more rides, which I really do enjoy. And then I used to call myself a runner and I got away from it, but I feel that I can call myself a runner again and starting to participate in that, and actually signed up for a 5K in April. So yeah.
Whoa, right?
Mhm.
Little baby steps to get you to something, right? That 5K and working up. That's awesome.
Yeah.
It's excellent.
Yes. Very good.
I
Yeah,
think
go
I
ahead,
would
Dr.
be
Davis.
remiss, I was focusing on just broadly, but I think also within the world of teledoc, you think about devices. We need to mention the ability to have a remote patient monitoring system where you can have devices that have that cellular connection to the cloud that allow you to really track your blood glucose readings, your hypertension, your blood pressure. If you're in a weight management solution, your weight. Of course, that's really valuable. Not everyone has access to our programs, but certainly having those available in so many ways, including accountability to a health coach, to a physician, are also really, really valuable.
Yeah, I mean, like
Great.
your point, Dr. Davis, you said you're doing pickleball with your family member, right? And that's just going to, there is research showing that power in numbers is a really powerful thing for certain types of goals, right? So physical activity, a video is boring to you, you don't want to walk outside. What could you do with somebody? So me
Yeah.
personally, my goal for 2024, which we'll see how it's going to go, but is to go to 3 boxing classes a week. There's going to be other people there. I usually don't work out with a group, so this is very new for me, but it's an added layer of accountability. You don't show up one day, the next day they go, "Where were you? How you go?" And so it's just really helpful to keep everyone on the same board. But
Totally. Dr. Davis, you playing pickleball for cheese? Is that like the reward?
We should try that. We should wager cheese. We should do that.
oh my
I think the other
gosh.
couples would be like, really? Is that where we're going with this? We're going to wager cheese? Yes.
Yeah.
Why not?
We are.
Oh my gosh. Cheddar for a win. That's awesome.
I love that.
Oh man. Well, thank you so much for being with us today, Dr. Davis.
My pleasure. Thank you so much for having me. Have a great year. Thank you.
Yeah, thank you so much, Dr. Davis. Really appreciate you. Love having you on our team. Thank you, everyone who listened in today. Be sure to check back to find out about our next live events coming in April. Until then, don't forget to reach out on our social media channels, leave any comments, any topics that you think you'd like to hear us talk about, and we'll see you next time on Healthier Ever After.
Happy New Year.
Thank you.
Thank you. Bye-bye.